name is David Little, and I am in private practice in San Antonio, Texas. I also serve as an adjunct clinical professor at the University of Texas Health Science Center Dental School in San Antonio. In this case, we're going to discuss impressing tooth number 10 for a single tooth full crown restoration. So when do you choose this technique? Well, as I walk around laboratories across the country and look in case pans, I'll notice that a majority of the cases are sent in this way. And if you ask the laboratories, they'll say, yeah, that is true, that's what we get most, but it always makes us nervous because if they're used correctly, they're great. If there's issues with them, it's because they're not used correctly. So let's look at why you would use this, when you would use it, and what can you do to make sure that you give them the best possible impression. There are a number of criteria for selecting the appropriate cases for the dual arch impression technique. Number one, the patient must be able to close into maximum intercuspation with no interferences. Cuspid guidance is the ideal occlusal scheme for this technique. The opposing teeth must have intact occlusal surfaces, again for a good bite, and the adjacent teeth must have acceptable morphology so that you can articulate the cast together. Before we talk more about impressions, let's back up a little bit and talk about preparation, because I think that is one of the keys to success of your restoration, especially predictable success. A few things that I want to make sure of is, one, I want to follow the manufacturer's suggested reduction requirements for each type of crown you're doing, whether it be gold, porcelain to gold, zirconia, lithium disilicate, whatever that is. And also, I think it's important to use depth cuts because that ensures that you get the proper reduction and you're not getting the phone call from the lab saying, we have to change the restoration because we don't have enough reduction or you're going to have to re-impress. So follow those criteria is one important feature to the success of the restoration. In continued discussion on preparation design, an important factor is, and I get this question all the time, where do you put the margin? Well, I think tissue sounding can help that. So one thing you want to do is you want to sound the tissue, and considering you normally have a 2 millimeter sulcus, ideally, if I'm in the posterior, I'm going to put it at the tissue as much as possible because I want to work super gingivally as much as I can. And when you get in the anterior area, you have to be a little more careful because you want to make sure that you hide the margin. And so in this case, if it's healthy, everything looks good, I'm going to put it about a 0.5 millimeter below. But if I have a deeper sulcus and I'm really trying to block out black triangles, then I know I have to lower that margin and be able to give the technician a chance to create those emergence profiles that give us a nice aesthetic result. So as you can see in this case, I actually used multiple different types of restorations, more all ceramic in the anterior, but as I went around to the posterior, then my margin placement was different based on the type of restoration. So that's an important consideration. And then the second part we'll talk about in a minute is wherever you put that margin, you need to be able to manage the tissue so that you can take an impression that is very accurate as well. So after we've done our preparation, the next step is to move towards tissue management. And the technique we're going to use in this case is Exvasil. And it's a very, very good product. And we'll discuss the benefits in the next slide. So Exvasil holds the rigidity in the sulcus and creates space. And that's really the key to a good impression, is creating that space so the impression material can pick up the margins of the restoration. So it does it, and what other techniques could you use? You could use cord, which is still one of the gold standards. You could use lasers, and any technique that is going to create that space. You also have to be able to control bleeding, and Exvasil works really well in this situation. It's also good to use it in just doing a class 2 restoration and you have a little hemorrhage or a little seepage. You can place a little bit before you do your restorative procedure. For the patient, it's quick, it's painless, and it's safe. And there is a little bit of a learning curve, and as we go through this case, we'll talk about those features. When placing the Exvasil, you want to start interproximally and press the tip against the long axis of the tooth, kind of like a packing cord motion, except that you don't have to put pressure like packing cord. You can bend the tip however you need to get access, and you slowly inject it into the sulcus. If you should encounter where it's it's not sticking into the sulcus, then either check and make sure it's dry enough, or if not, it means you're putting it in too fast and you can back off a little bit. The exquisite material is water soluble, so the best way to rinse it off is using the air water syringe, and you want to make sure you completely remove all the material. And the fact that it's green is actually easy to see, so at the same time you also want to make sure that you have good access and you can visualize the margin all the way around. If you don't, if it's necessary, you can always go back, reapply, and make sure that you have the access that you need. There's many different types of trays out there. The most important thing is to make sure that it's not impinging anywhere and you can get and replicate their bite with it in their mouth. I prefer to do this before anesthetic because that way I can mark where their occlusion is and visualize that so that when I put them back into the impression, I know that I'm getting the proper bite recorded. It is very important to have your assistant load the tray simultaneously as you are syringing around the tube. But one important thing is that it's very, very critical that the tray is not underfilled. If you underfill a tray and don't capture all the detail, then you're going to have a remake and not a good situation. So I always advise my assistants to overfill the tray, because if you overfill it, worst case is you use too much material, but you'll still capture the detail that you want to capture. This rigid material, that by the Take One material, first Take One material, it's one of the biggest benefits of using this material. It has a very rigid set, which really helps in the lack of distortion and the accuracy of your impression. So this step is very critical to the success of the restoration. In placing the Take One light body material, again, I like to start in the interproximal area and slowly syringe around, keeping the tip in the sulcus, all the way around, moving slowly. And it's also important that you keep the tip in the impression material so that you don't incorporate air. And you notice I'm very liberal with my material. Again, I'd rather have more material than less, and you can see I'm syringing it all the way around, timing it with my assistant, getting ready to place the tray. So now, once I seat the rigid, and my rule is whoever seats the tray stays with the tray. So I want to ensure that the patient is biting properly, and I want to hold that patient in position, and I don't want to transfer that to the assistant. I want to make sure I stay there and make sure that that happens. Always verify that the material is set, then remove the tray, and you'll see because of the rigid material it's going to fit well. You'll have to snap it out, and then the first thing you're going to want to do is to check for the accuracy of the impression. And you can see we're looking at the preparation, but also the teeth around it as well. It's important to inspect the impression thoroughly. Make sure that you've captured all the detail you need on the preparation, and also the teeth on either side, the adjacent teeth, and also the opposing teeth, and make sure your bite is where it needs to be, because it's much easier to take a new impression at that time while the patient's still seated than to have a bad impression, have to come back for a remake. So you really want to make sure that you do that. But if you follow the steps like we've talked about, you're going to get a very consistent, very accurate result. As you can see, with the close-up in the middle, the accuracy, and that leads to an accurate die, which in turn leads to a very nice definitive restoration. As you can see in these smile photographs of the final restoration, the impression is the foundation for quality restorations. And that's why we've spent this time to see the importance of the restoration. And the dual arch technique is a very predictable, very accurate technique as long as you take the steps to do it correctly. I think there's a huge advantage of using the rigid tray material. It gives the tray stability and also helps for a more accurate impression in conjunction with the Take One light body material. Dual arch technique can create accurate impressions when they're used correctly. This technique is really easy for patients, and especially if I have a patient that's a gagger, this is my technique of choice. And also, when we get down to it, it actually saves time because you're taking the upper impression, the lower impression, and your bite restoration all at the same time, and that does save time and money.